This lab result is easy to ignore. You see TSH, T4, or T3 on your blood test, but you may not know what those letters mean. Maybe you feel tired, anxious, cold, hot, or your weight has changed, but you are not sure if it is your thyroid. Thyroid hormone problems can affect energy, heart rate, body temperature, weight, bowel habits, mood, and sleep. But symptoms can be vague, and many other conditions can look similar. That is why the goal is not to self-diagnose. The goal is to organize your symptoms, lab values, medications, and questions before you talk with a licensed clinician. The thyroid is a small, butterfly-shaped gland in the front of your neck. It makes hormones that help control how fast or slow many body processes run. The main thyroid hormones are T4 and T3. T4 is called thyroxine. Think of it as the main storage form. T3 is called triiodothyronine. It is the more active form that affects many tissues. Your brain also plays a role. The pituitary gland makes TSH, which stands for thyroid-stimulating hormone. TSH is like a message from the brain telling the thyroid, make more hormone or slow down. In simple terms, if thyroid hormone is too low, the pituitary may send more TSH. If thyroid hormone is too high, the pituitary may send less TSH. That is why doctors often look at TSH together with free T4 and sometimes T3 or thyroid antibodies. There are two common patterns people hear about. Hypothyroidism means the thyroid may not be making enough hormone. The body may feel like it is slowing down. Hyperthyroidism means there may be too much thyroid hormone effect. The body may feel like it is speeding up. But these are simplified explanations. Lab results, symptoms, medications, pregnancy status, other illnesses, and medical history all matter. Thyroid symptoms can be easy to miss because they overlap with stress, sleep problems, diet changes, aging, depression, anemia, heart problems, and many other conditions. Here are common signs or lab clues worth discussing. Possible low thyroid clues include unusual tiredness, feeling cold, weight issues, constipation, and more. 1. Feeling unusually tired or slowed down. 2. Feeling cold when others are comfortable. 3. Weight gain or difficulty losing weight. 4. Constipation. 5. Dry skin, dry hair, or hair thinning. 6. Low mood, brain fog, or forgetfulness. 7. Heavier or irregular menstrual periods. 8. A high TSH result, especially when paired with a low free T4. Possible high thyroid clues may include feeling hot, a fast heartbeat, shakiness, and more. 1. Feeling hot or sweating more than usual. 2. A fast or irregular heartbeat. 3. Shakiness or hand tremor. 4. Anxiety, nervousness, or irritability. 5. Trouble sleeping. 6. Weight loss despite normal or increased appetite. 7. Frequent bowel movements or diarrhea. 8. A low TSH result, especially when paired with high free T4 or high T3. These clues do not prove you have thyroid disease. Most thyroid concerns can be discussed with a doctor, but some symptoms need urgent care. Seek urgent medical care if you have chest pain, severe shortness of breath, fainting, confusion, severe weakness, or a very fast or irregular heartbeat. These symptoms can have many causes, including heart problems, infection, or severe thyroid hormone imbalance. Also, contact a healthcare professional promptly if you are pregnant or have a known thyroid condition and your symptoms suddenly change. When you talk with your doctor, they may ask questions such as, when did your symptoms start? Are they getting better, worse, or staying the same? Do you feel unusually tired, cold, hot, anxious, shaky, or short of breath? Have you noticed weight changes, bowel changes, hair or skin changes, sleep problems, or menstrual changes? Do you feel your heart racing or skipping beats? Have you noticed swelling or fullness in the front of your neck? Have you had thyroid disease, thyroid surgery, radiation treatment, pregnancy, or recent illness? Do you take thyroid medication, amiodarone, lithium, biotin supplements, iodine supplements, steroids, or other medicines? Does anyone in your family have thyroid disease, autoimmune disease, or thyroid cancer? These details help your doctor decide what your lab results may mean and whether more testing is needed. Doctors often start with a blood test called TSH. Depending on the result and your symptoms, they may also discuss free T4, T3, thyroid antibody tests, or other tests. A high TSH can suggest that the thyroid is not making enough hormone, especially if free T4 is low. A low TSH can suggest too much thyroid hormone effect, especially if free T4 or T3 is high. But patterns can be more complicated, especially with pregnancy, severe illness, pituitary problems, or certain medications. Doctors may also discuss thyroid peroxidase antibodies, often called TPO antibodies, when autoimmune thyroid disease is suspected. For possible Graves' disease, they may discuss thyroid-stimulating immunoglobulin or related antibody testing. If there is a lump, swelling, or neck fullness, they may discuss a thyroid ultrasound. In some hyperthyroid cases, imaging or radioactive iodine uptake testing may be considered, depending on the situation. Medication history is very important for thyroid visits. Tell your doctor if you take thyroid hormone medicine, antithyroid medicine, heart rhythm medicine, lithium, iodine supplements, kelp products, steroids, or high-dose biotin. Biotin, a common hair and nail supplement, can interfere with some thyroid lab tests. Do not stop any medication on your own. Ask your clinician what to do before testing. Contact a healthcare professional promptly if you are pregnant, recently pregnant, trying to conceive, or have a known thyroid condition, and your symptoms suddenly change. When you see your doctor, they may ask, when did your symptoms start? Are they getting better, worse, or staying the same? Do you feel unusually tired, cold, hot, anxious, shaky, or short of breath? Have you noticed weight changes, bowel changes, hair or skin changes, sleep problems, or menstrual changes? Do you feel your heart racing or skipping beats? Have you noticed swelling or fullness in the front of your neck? Have you had thyroid disease, thyroid surgery, radiation treatment, pregnancy, or recent illness? What medicines and supplements do you take? Does anyone in your family have thyroid disease, autoimmune disease, or thyroid cancer? Doctors often start with a blood test called TSH. Depending on your symptoms and the result, they may also discuss free T4, T3, and thyroid antibody tests. A high TSH can suggest the thyroid is not making enough hormone, especially if free T4 is low. A low TSH can suggest too much thyroid hormone effect, especially if free T4 or T3 is high. But one number alone is not the whole story. In some cases, doctors may discuss thyroid peroxidase antibodies, also called TPO antibodies. For possible Graves' disease, they may discuss thyroid-stimulating immunoglobulin or related antibody testing. If there is a lump, swelling, or neck fullness, they may discuss a thyroid ultrasound. Not everyone needs every test. Medication history is very important for thyroid visits. Tell your doctor if you take thyroid hormone medicine, antithyroid medicine, amiodarone, lithium, steroids, iodine or kelp supplements, or high-dose biotin. Biotin, a common hair and nail supplement, can interfere with some thyroid lab tests. Do not stop any medicine on your own. AI can help before your visit, not by diagnosing you, but by organizing your information clearly. Start with a symptom timeline. You can ask AI, help me organize my thyroid-related symptoms into a timeline for my doctor. Do not diagnose me. Include when symptoms started. What changed? Whether symptoms come and go, and how they affect daily life. Next, organize your lab values. Create a table with the date, test name, result, reference range, and notes. Include TSH, free T4, T3, thyroid antibodies, and any other labs your doctor ordered. Different labs can use different reference ranges, so include the reference range from your actual report. You can ask AI, turn these thyroid lab results into a clean table for my doctor. Do not interpret them as a diagnosis. Now prepare your medication and supplement list. Include prescription medicines, over-the-counter medicines, vitamins, supplements, protein powders, iodine or kelp products, and biotin. If you already take thyroid medication, write down how you take it. Do you take it with food, coffee, calcium, other medications? Timing can matter, so bring the details to your clinician. Family history can also help. Write down whether close relatives have hypothyroidism, hyperthyroidism, Graves' disease, Hashimoto's disease, thyroid nodules, thyroid cancer, or other autoimmune diseases. You do not need perfect details. Even a simple family history can help guide the conversation. Finally, prepare your questions. Here are useful questions to ask. What do my TSH, free T4 and T3 results mean together? Should these labs be repeated? Could my symptoms be from my thyroid, or should we also check for other causes? Could any of my medicines or supplements affect thyroid labs? Should I be tested for thyroid antibodies? Do I need a thyroid ultrasound? If treatment is needed, what are the benefits, risks, and follow-up plan? How often should my thyroid labs be checked? What symptoms should make me seek urgent care? Be careful with online claims about thyroid detoxes, miracle diets, or supplements that promise to fix hormones. Thyroid problems can be real medical conditions. The right plan depends on the cause. Nutrition, sleep, stress management, and exercise can support overall health, but they should not replace medical evaluation when thyroid disease is suspected. Thyroid hormones affect many parts of the body. T4 and T3 are thyroid hormones. TSH is the signal from the pituitary gland that helps regulate the thyroid. Low thyroid hormone effect may slow the body down. Too much thyroid hormone effect may speed the body up. But symptoms and lab results must be interpreted by a qualified clinician. AI can help you organize symptoms, lab values, medications, family history, and questions. But AI cannot diagnose thyroid disease or choose treatment for you. This video is for educational purposes only. AI can help organize information, but it cannot diagnose, treat, or replace a licensed clinician. If you have severe symptoms such as chest pain, fainting, confusion, trouble breathing, or a very fast irregular heartbeat, seek urgent medical care. Screen. Subscribe for clear health explainers and doctor visit preparation tips.